This is the Epoch Times.
Welcome to Epoch Audio, showcasing the best journalism covering news, culture, and society, addressing issues overlooked or avoided by other media. For the text version of this and more articles providing truth, tradition, and hope, please go to theepochtimes.com.
FDA issues alert on wrong COVID vaccine doses for children, written by Jack Phillips. The U.S. Food and Drug Administration, FDA, issued an alert to healthcare providers to administer the right dosage of Moderna's COVID-19 vaccine to children amid reports that double doses were given to children. We are advising healthcare providers who administer the Moderna COVID-19 vaccine to individuals 6 months through 11 years of age to ensure that the correct volume of the vaccine is withdrawn from the vial so that the correct dose is administered to the vaccine recipient, the FDA alert said. The FDA said it has since revised a fact sheet for healthcare providers on the mRNA vaccine to further clarify that 0.25 milliliters should be withdrawn from the vial and that the vial and any excess volume should then be discarded. The agency added it has become aware that some healthcare providers may not recognize that the single-dose vial of Moderna COVID-19 vaccine 2023 to 2024 formula for use in individuals 6 months through 11 years of age contains notably more than 0.25 milliliters of the vaccine. Some healthcare providers may be withdrawing the entire contents of the vial to administer to an individual. However, the volume of a single dose is only 0.25 milliliters. It came after a 5-year-old girl in North Carolina accidentally received a double dose of COVID-19 vaccine, according to the child's mother. The unnamed mother told WRAL-TV that the girl recently received the shot but was called by the doctor's office, who told her that we made a mistake when they gave the girl the vaccine. We gave her a double dose instead of a single dose, she said. The woman did not say what brand of vaccine was given to her daughter. Although the FDA has approved the mRNA shots made by Pfizer and Moderna for kids, it's not clear if the FDA issued the health alert in response to that specific reported incident in North Carolina. However, throughout the COVID-19 pandemic, it was common for healthcare providers to get dosage levels wrong for COVID-19 vaccines. According to the U.S. Centers for Disease Control and Prevention, CDC, it was required to report dosage errors to the Federal Vaccine Adverse Event Reporting System, VAERS. Last year, the World Health Organization, WHO, issued a statement that the UN health body was, quote, aware of an increasing number of reports regarding COVID-19 immunization errors in children, unquote, including, quote, the use of adult dose in children and use in inappropriate age groups, unquote, among other errors. In late 2021, more than a dozen children were given an incorrect COVID-19 vaccine dosage in Antioch, California, according to local reports. Some children received double the amount they were supposed to. In a more striking example, more than 110 children aged 5 to 11 were given the wrong dose of a COVID-19 vaccine at a pharmacy in Loudoun County, Virginia, in November 2021. The county's health officer at the time said that the pharmacy that administered the shots incorrectly attempted to use the adult vaccine to provide to children by cutting the doses into thirds. The Epoch Times has contacted the FDA for comment on Friday. Uptake still low. While the FDA and CDC both essentially signed off on the latest booster shots made by Moderna, Pfizer, and Novavax in September, recent data has signaled that uptake appears to be relatively low. About 15 million people in the United States, including children and adults eligible to get the vaccine, have received the latest shot as of October 27. Figures from the Department of Health and Human Services, HHS, show That amounts to more than 4.5% of the American population. An HHS spokesman said in a statement, "As of October 27, more than 15 million Americans have received the updated COVID-19 vaccine, and over 19 million vaccines have shipped to pharmacies and other locations, with 91% of Americans 12 years and older living within 5 miles of a vaccination site." By October 26 of last year, approximately 23 million people had received the initial updated booster shot according to CDC data. The 2022 fall vaccination campaign started around 10 days earlier than the 2023 season. In all, about 56.5 million people, or 17% of the U.S. population, got last year's booster. The lower demand for the vaccines has prompted both Pfizer and Moderna to slash their revenue guidance. Last month, Pfizer announced it would revise its estimate of COVID-19 vaccine sales by $2 billion compared to what it had previously forecast, and Moderna this week announced it would too revise its vaccine sales down by about $2 billion. In a Thursday call with investors, executives said Moderna is now working to increase a sense of urgency to get vaccinated by encouraging medical providers to recommend the COVID-19 shot. It would also run more ads. Moderna Chief Customer Officer Arpa Garay said during the call, "Our assumption is everyone who has gotten their booster in 2023 will at least get their booster also in 2024 and beyond." Shares of Moderna closed 6% lower on Thursday. So far in 2023, Pfizer's stock has plunged about 39%, and Moderna's has dropped 56%. As for Pfizer, the firm confirmed to local media outlets this week that it would shut down 2 plants in North Carolina amid a widespread cost-cutting initiative. Thanks for listening to Epoch Audio. That was FDA issues alert on wrong COVID-19 vaccine doses for children, written by Jack Phillips. Reuters contributed to this report. Read by Susan Williams.
For more Epoch Times articles in text, please visit theepochtimes.com.
This is the Epoch Times.